بسم الله الرحمن الرحيم. احنا طبعا المرة اللي فاتت بدأنا نتكلم عن الهيبنوتيك دراجز، وقلنا ان الدراجز or hypnotic drugs are drugs which induce hypnosis. And as we said that there are many neurotransmitters in the CNS like acetylcholine, adrenaline, noradrenaline, dopamine, serotonin, GABA, glycine, glutamate, endorphin, substance B, histamine, prostaglandins. All are these are neurotransmitters or transmitters in the CNS. We have a lot of neurotransmitters. And we started by studying the sedative, hypnotics, and anxiolytic drugs. As we said before, the major group are barbiturates. As we studied it in full details, but now I will try to summarize what I said before. I said that barbiturates are derived from barbituric acid, which has no hypnotic action. These barbiturates may be long action or long acting drugs, may be intermediate or may be short acting, and the last and the fastest one is the ultra short acting groups. As we said that the long acting, we have an example of phenobarbital, which it has a long duration of action. It stay from 6 up to 8 hours, and the intermediate like imobarbital, which is moderate action, that it stay from 4 up to 6 hours. The third group, which is short acting like pentobarbital or secobarbital, and these groups having a duration of action from 2 up to 4 hours. The last group from the barbiturates is known as the ultra short acting. Ultra short acting like thiobarbital or thiopentone. And we said this the fastest or the rapid group. It has a short duration of action, about half an hour up to half an hour. They are very rapidly acting. They have a very lipid solubility property. They are rapidly uptake by the tissue and mainly concentrated in the CNS. These ultra short group are used mainly to induce the anesthesia in operations which needs a short duration of action, like curettage, which used for induction of abortion, or if there is any remnant or taking a biopsy from the uterus. The barbiturates, as we said in the previous lectures, that they are absorbed from the GIT or from the site of injection, distributed all over the body. They can pass through the blood-brain barriers, they can pass through the placental barrier, and they can bind with the plasma protein. In the same time, they metabolized mainly in liver and excreted mainly in the urine, especially in alkaline urine, because they are weak acidic drugs. These drugs, as we said, they are long-acting, intermediate, short, and ultra-short acting. The main mechanism of action of these drugs is related mainly to their effect on the GABA receptors. The GABA, which are the main inhibitory receptors in the CNS. We have GABA A and GABA B. These barbiturates are mainly potentiating the depressant effect of the GABA A receptors. This occurs by stimulating the GABA A receptors. Stimulation of the GABA A receptors will lead to opening of the chloride channels. These chloride channels will be open. This opening will causing hyperpolarization. In case of barbiturates, they have the ability to open all the chloride channel directly. This occurs with large dose. They have direct effect on chloride channels. They can open the chloride channels directly, leading to more or greater effect on the CNS more than the benzodiazepines and more side effect than benzodiazepine. As showing in this draw, we said that when there is no response, as we see from the first draw A, that benzodiazepine receptors are mainly besides the GABA receptors and then the chloride channels. The channels are not open, it is closed, and there is no stimulant for the benzodiazepine or GABA receptors. When we give barbiturates, there is a stimulation of the GABA A receptors, leading to opening of the chloride channels, which give us response. When we use the benzodiazepines are initiating or stimulating the benzodiazepine receptors, and this will leading to initiation or stimulation also of the GABA receptors, leading to more opening of the chloride channels and depolarization. This drawing is it can be briefly explain the mechanism of action of both benzodiazepine and barbiturates. Barbiturates has many effects, but due to their limited use, we shall discuss mainly their effect on the CNS. It has a sedative action. When we use it or in a dose of about 1/3 of the normal dose, they causing sedation. Then the normal dose can causing sleep and hypnosis. But sleeping, which induced by the barbiturates due to their great effect on the CNS, it is followed by hangover, because barbiturates inhibit the rapid eye movement sleep or the dream sleep, leading to non-rapid eye movement or non-dreamy sleep. This causing that the patient, when taking barbiturates, when he is get up, he is suffering from hangover. The large dose of these barbiturates will leading to respiratory depression, coma, and death. In the same time, in the old patients, they may causing amnesia. In the same time, they are potentiating the action of analgesics like aspirin or morphine. They has no analgesic effect, but they can potentiate the analgesic effect of other drugs like aspirin or morphine. Barbiturates has a stimulant effect on the antidiuretic hormone, but they are very effective as anticonvulsant, especially phenobarbital in status epilepsy. And as we said before, that the ultra short acting can be used in operations which taking a short time of action. So the sedative dose is about 1/3 of the hypnotic dose, and the hypnotic dose from 100 up to 300 milligram. So they are used mainly as sedative. They used as hypnotics or inducing of sleep in treatment of insomnia. If it's insomnia is early in night, we can give short acting like pentobarbital. If it occurs in the middle time, I can give intermediate like emobarbital. If it occurs late time, we can give it long acting like phenobarbital. And as we said, we can use them as anticonvulsants and anti-epileptic. They can be used as anesthetic, and used also in abreactions which may occur in hysterical patients. Barbiturates has many side effects. They are powerful as enzyme inducers, so they can causing automatism, especially in old patients, which leading to toxicity. Also, the patient which taking them is suffering from hangover, allergy, and especially in old patients, they may causing insomnia, they may causing excitation due to idiosyncratic effect. The side effects of thiobarbital, that it may causing severe hypotension, especially in large dose and in elderly patients. This hypotension relating to their effect on vasomotor center inhibition and the sympathetic effect. In the same time, in large dose, they causing respiratory apnea, bronchospasm, they may causing neonatal asphyxia. In the same time, when we give them by injection, if the injection is repeated in the vein, it may causing thrombophlebitis. If it is extra or out of the vein, it may causing extravasation, which causing sloughness and necrosis. And if it is injected wrong in intra-arterial, they may causing thrombus. Lastly, injection of these drugs in the nerve may causing paralysis. As regarding the toxicity, barbiturates are the drugs or one of the drugs which causing dependence. But here we can treat this dependence by gradual withdrawal of these drugs. If the patient is suffering from acute toxicity due to taking a large amount of these drugs, he will come to you with the respiratory depression, mainly due to inhibition of the respiratory, the vasomotor, the heat regulation center, which causing respiratory depression, hypotension, and in the same time hypothermia. So the first line of treatment of this toxicity is stomach wash. This wash will be made by using sodium bicarbonate or charcoal with saline, and I must do it within 2 hours or within 2 hours to avoid any complications like aspiration pneumonia, especially when the patient is comatose. When the patient is comatose or it takes the toxic dose and I don't make wash within 2 hours, it's contraindicated to avoid aspiration pneumonia. In the same time, I make for him endotracheal intubation and artificial respiration. I make hemodialysis. In the same time, I can make forced diuresis by giving him glucose, 5% glucose. I making the urine alkaline by giving sodium bicarbonate. I give him diuresis like furosemide or Lasix intravenously for causing forced diuresis. So at the same time, if there is hypotension, I can, or hypovolemia, I can give him dextran or blood, and I give him analeptic drugs to stimulate the respiratory and the vasomotor, especially when they are depressed. These analeptics like permethrin, like carbon dioxide, 5%. The contraindication of these barbiturates that they are contraindicated in head injury due to their effect on the CNS like respiratory inhibition, vasomotor inhibition, and heat regulation center. And at the same time, they must be avoided in the patient who are suffering from bronchial asthma, emphysema. I must avoid them in shock or hypotension due to their effect on the vasomotor center and the sympathetic activity. Also, they must be avoided in liver disease, kidney disease, allergy, idiosyncrasy, especially in old patients. And I must avoid them in patients who are suffering from acute intermittent porphyria, because if I give them barbiturates will stimulate the D-aminolevulinic acid, leading to sensation or synthesis of porphyrin. So in acute intermittent porphyria, it's contraindicated to use barbiturates. As regarding their interaction, we said that they are enzyme inducers, especially phenobarbital. So they can affecting the metabolism of other drugs and decreasing their action, like dicamelor, like digitalis, like dexamethasone, diphenylhydentone, and vitamin D. If I give them for a long time, they affecting or leading to decreasing the action of vitamin G, leading to osteomyelitis. Also, if I give them with other depressant effect, they increasing the depressant effect of other drugs like alcohol and the analgesic effect of other drugs like morphine or aspirin. The second group, as we said, benzodiazepine, which affecting benzodiazepine receptors. And as we said, we have two main classifications according to their mechanism of action, that they are having long duration of action, intermediate, and short, as we said. In the same time, we have another classification according to their uses, that they can be used as sedative or tranquilizers, as hypnotics, and they can be used as an anti-epileptic, as an antispastic, that they have a central muscle relaxant effect, especially diazepam and clonazepam, especially diazepam and clonazepam. In the same time, they can be used also for induction of anesthesia when I give them intravenously, especially also diazepam and midazolam. As regarding their mechanism of action, we said it in a brief manner that most of them are metabolized in liver and then conjugated in form of conjugation, and then they are excreted in urine mainly. The mechanism of action, that they are working in two main benzodiazepine receptors. Benzodiazepine 1, which is the main one mediating sedation, and the benzodiazepine 2, which is mediated as an anti-anxiety. And as we said, their mechanism of action, by acting mainly on benzodiazepine receptors, GABA opening of the chloride and leading to hyperpolarization, as we discussed this point before. As regarding its uses, as I said, they are used as sedative tranquilizers in taming of animals, for example. They used as hypnotic, as anti-seizures or anti-epilepsy. They used in anesthesia. They used also as a central muscle relaxant drugs, and in the same time they are mood stabilizers. They can be used as mood stabilizers. The main antidote of these drugs is flumazenil. Flumazenil is a competitive benzodiazepine antagonist. Competitive benzodiazepine antagonist. In case of benzodiazepine in toxicity, it can be given intravenously. So from this we can say that benzodiazepine are more preferred or having more advantage than barbiturates. They have a wide safety margin. In the same time, they are more selective on the CNS and a very, very little effect on the cardiovascular and respiratory depression. Also, they have the advantage that they have no hangover or rebound paradoxical sleep. They improve the sleeping habits even after I disconnected them, which means that if I stop using these benzodiazepine, they can keep us in normal habits sleeping. Benzodiazepines have the advantage that they are not enzyme inducers, and in the same time they have no or less dependence effect. As regarding their side effect, they can causing dependence or withdrawal symptoms if I stop them suddenly, In the same time, they can causing ataxia or drowsiness and hangover, and to, as I said, very, very weak in comparing with barbiturates. They may causing alcohol intolerance. In the same time, they may cause excitation or excitement in some schizophrenic people. As regarding their side effect on cardiovascular, they may causing hypotension or bradycardia, the increasing appetite, especially in females, and at the same time they may causing menstrual disturbance, ovulation in females, and decreasing sexual desire in male, and finally they may causing allergy. As I said, flumazenil is the specific, or it is a blocker or antagonist of their action by competitive inhibition, and it is given by intravenous infusion. Now we shall start the third one, which is known as cholar hydrate. Cholar hydrate can be absorbed completely from the GIT, passes through the blood-brain barrier, metabolized mainly in the liver by oxidation and conjugation with glucouronic acid into inactive component, which is excreted mainly in urine. So it has a sedative, hypnotic effect, especially I can use it in extreme of edges as a sedative and hypnotic in extreme of edges and in bronchial asthmatic patients, because in therapeutic doses they are not inhibiting respiratory center or vasomotor center. So cholar hydrate is safe as a sedative, as a hypnotic, especially in bronchial asthmatic patients, or in extreme of edges, because it is devoid of effect on the respiratory center and vasomotor center. In the same time, it has an locally irritant effect on skin and on mucous membrane, especially in stomach. So it's contraindicated in patients who are suffering from peptic ulcer. So I can use it as sedative, as hypnotics, and used also in pre-anesthetic medication in children and in bronchial asthmatic patients. Cholar hydrates can be given in milk or juice, diluted by milk or juice in dose half up to 2 grams orally. If it caused acute toxicity, or if I take a large amount of cholar hydrate, I will suffering from nausea, vomiting, pinpoint pupil like morphine, pinpoint pupil like morphine toxicity, inhibition of the respiratory and the vasomotor center, while in chronic toxicity it is causing dependence. Cholar hydrate is contraindicated, as I said, in peptic ulcer because it is an irritant to the mucous membrane, especially stomach. It's contraindicated in bronchitis and in advanced liver and kidney disease. Butyraldehyde has a bad taste and odor. It is liquid. I can give it in milk or with milk due to its bad effect and odor. It's used as sedative and hypnotic. It's used as anticonvulsants, especially in status epilepsy and eclampsia. I can give it by intramuscular or by rectum, and I can give it in form of liquid in rectum in basal anesthesia. Subaraldehyde is used as sedative, as hypnotics, diluted with milk due to its bad odor and taste, and I can give it in state of convulsions or eclampsia. If there is eclampsia, which is known toxicity of pregnancy, I give him it to avoid convulsions or in case of convulsions, and it can be given per rectum as a basal anesthetic. At the same time, it's contraindicated in the liver and lung disease. We have a lot of sedative and hypnotic drugs, as we said, like morphine. We discuss morphine in full details, and I can use it as a hypnotic in case of severe pain, because it is a mainly pain killer. We have xylodomide, which is completely devoid due to its side effect and the teratogenic effect, and it's used only in myeloma nodosum, and while the others like alcohol or bromide, their using is very, very limited.